In this video, we're going to look at the natural posture and alignment of the spine and how when you come out of that posture, that's what causes pain. So there was a video before this one that showed the different structures of the spine and how it all works together. I'd recommend looking at that one before taking a look at this one. So Mike, can you come over here? My brother's going to help us out today. So as he's standing here, you see I have the spine here. We have his hips, we have his lumbar spine right here, we have his thoracic spine here, and his cervical spine here. And you'll see there's a curve to it. So this is lordosis. This is that natural arch that you see in people's lower back. And then the upper back usually hunches forward a little bit. That's this kyphosis. And then the neck, if you look at Mike's neck, there's an arch kind of coming this way. And that's what you can see here on the spine. So the lumbar and the cervical areas have that same arch coming this way, and then the thoracic area has the opposite arch. All right, thanks, Mike. So why is it like that? Well, there's a number of reasons, but it helps with shock absorption. So if your spine has a nice curve to it like this, when there is shock that needs to be absorbed, all the different areas of the spine can absorb it. This can bend backwards a little bit. This will bend forward. This can bend backwards, and this lumbar part of the spine can bend forward. And that all helps with some of the shock absorption. You can imagine if your spine was totally straight like this, when you had to absorb shock, there wouldn't be as much area to go. It would just be the discs being compressed without any give. So that natural posture helps with that. And also, it works in a nice system because when one area bends backwards, the other area can bend forwards, and so forth. So they kind of counterbalance each other. Now, when you're in a nice alignment, we'll look at the lower area. You'll see there's these nice big spaces for the nerves on the side of the spine, right here. Nice big area, just like that. You can actually see it even better on this other spine here. You can see this big hole here where there's a lot of space for the nerve. And also when you look at the back, the joints here are exactly where they need to be. They're not overstretched up where the ligaments are being stretched. They're not too far down where it's being stretched or compressed. Everything is happy because it's in perfect alignment. When you take the segments out of that alignment, whether it be too far forward, too far back, or too far from side to side, that's when things start getting overstretched and compressed and causing pain. Another thing to note about the spine is that what it does is it supports the head and the shoulders, the arms, the whole upper body, and it transmits all of that force down to the pelvis and your hips and your legs. And your lower body, the hips and the legs, that is the foundation for the body. It's the strongest area, and it needs to support everything above it. And the spine is the link between the upper body and the lower body. And because it is designed so well for movement in any single direction, if you're not careful about that movement, or you start kind of abusing the fact that it can move in so many different directions, you can put it out of alignment, and that's what can cause you pain. And the reason why spine pain, neck pain, low back pain can be so difficult to figure out and to fix is because anything can throw it off. If you have a collapsed arch in your foot, that will drop your pelvis one way. If your hip flexors are tight, that can take your pelvis and tip it forward. If you sit too much, that can round your back out. If you have a poor posture and in the upper body and you bring your head forward, that brings it out of alignment. There's so many different things that can bring it out of alignment, and it really takes an evaluation by a skilled professional to be able to identify that cause for you, and so that you can go ahead and start fixing it. So now you know more about the natural alignment of the spine and how falling out of that alignment can cause pain. So now you need to check out the next and final video in this series about what exactly is causing that pain. Like, where is that pain coming from? So we'll go into that in the next video.